The 5th Annual Digital Health Hub Foundation Awards seeks to find the most impactful and disruptive digital health companies. Out of 1,500 submissions, only a select few have become quarter-finalists. Let's learn what their superpower is.
Hi, I'm Raj Dash, co-founder of Clint, the clinical intelligence platform, and this is the product demo for the population dashboard. What you're seeing on your screen now is 200,000 patients, all of whom are fully eligible for a clinical trial out of our 300 million patient EHR dataset. We know that they are eligible, but we want to show the sponsor a higher risk subcohort, which happens to be the African American subcohort, which has a totally different geographic distribution. This allows them to choose different sites and emphasize those sites more in their trial design. And we can integrate with each of those sites and give identified lists of eligible African American patients and other patients to those investigators and clinical teams. This is Clint streamlining diversity and inclusion at a national scale.
Now, hear in their own words why they should win.
Hi, I'm Raj Dash. I'm a Stanford cardiologist and co-founder of Clint, the clinical intelligence platform. Clint delivers clinical grade patient therapy and patient trial matching at the point of care and at the population level. And we are using this to improve care quality and health equity in patients. Now, normally clinical research and clinical care are kept very separate. This is actually preventing patients from receiving potentially life-saving treatments. Clint shows care and research teams which patients should receive the right treatment or trial at the right time. Now, our superpower and differentiator is our proprietary contextual layer that we add on top of the EHR. Clint leverages deep clinical concept maps and machine learning methodologies to look at patient data precisely the way a doctor would. Because of this superpower, Clint produces therapy and trial matching results that are 10 times more accurate than other solutions in the market. For example, let's look at diabetes. Most patient matching solutions will miss 45% of all diabetic patients in their system because they rely on ICD-10 codes. Well, Clint finds those patients by using the patient's medications, their labs, their comorbidities, and their patient journey over time to piece together the right diagnosis as well as their disease trajectory at that moment. We can then codify medical guidelines and recommend what to do next. For clinical research, if we continue to recruit first come, first serve, will only perpetuate the huge disparities in clinical research that we see today. Clint matches all trial-eligible patients across a health system at one time and provides that list to site investigators and even directly to treating clinicians in the EHR. And by finding those patients all at once, we can prioritize and oversample from underrepresented groups and make sure they're seen first to ensure D&I balance. So why should we win? We have a powerful platform unifying clinical research eligibility and care decisions. And we are injecting a real lever to improve diversity and inclusion for trial recruitment. But lastly, even when the drug is approved and in the guidelines, we can push that evidence-based insight directly to the point of care to improve outcomes.
Follow their journey as they strive to become a finalist against a very strong field. Join us on October 9th for our grand finale at Health in Las Vegas to witness the winners crowned.